Well, many of us have probably tried almost everything to whiten our teeth, including white strips, baking soda, but in-office whitening may be a better alternative. Dr. Moriarty is here this morning to talk about the process. So really, what is the difference between having your teeth professionally whitened in an office versus, you know, all of the stuff we see in the grocery store?
Right. So, you know, the main difference or the main similarity between the two is they both use peroxide as the active ingredient. So the in-office stuff is, you know, it's going to be a little bit stronger. You know, when you go to the dentist, they can professionally kind of monitor it and make recommendations based on the types of stains. So the stuff you're going to get over the counter, like the white strips and the toothpaste and the mouth rinses, things like that, they're very small strengths of the peroxide, okay? But in office stuff, there's a couple different ways you can do it, but that stuff can be professionally monitored, and it is going to be a lot stronger and more precise as to what you're trying to achieve.
What are some of those options in the office?
So usually there's two main differences. There's going to be the custom trays, which we would make. You come in, you get impressions taken, you're given whitening gel, and you can use that over the course of, you know, a few weeks in order to whiten the teeth. The other alternative to that is for someone who wants, you know, the maximum amount of whitening done, and you know they want it to be done quick, and that would be something like a Zoom or like a KoR Whitening. That's also really good for, you know, very, very heavy stains. Certain people that have what's called like tetracycline staining, and they've had certain antibiotics when they were, you know, a child.
Younger, yeah.
They have stains that, you know, you just can't, you know, brush away. You can't whiten with regular whitening, and it's going to be resistant to most types of whitening. But the in-office would be the main treatment for that.
What kind of pain is involved? I mean, I know teeth can get sensitive, right?
Pain is a very strong word.
Right.
So I would say more so discomfort. So, you know, it's there can be some sensitivity, you know, associated with it. The good part about it is that, you know, basically that is very mild, if anything, and a lot of times it's just over the course of while you're whitening. If you're having that discomfort, you know, typically it'll kind of go away if you discontinue the whitening. There's also things you can do. You can get like a Sensodyne or like a toothpaste with potassium nitrate in it, or you can take some sort of over-the-counter pain medicine like Advil or Tylenol.
But it's short-lived,
in order to, it is. A couple days, as soon as you stop the whitening, it kind of goes away.
How much does something in-office cost?
Typically the in-office whitening trays would go for anywhere in the $300 to $400 range, and then the, you know, the Zoom whitening or the KoR Whitening would be anywhere from like $500 to as much as $1,000. I've seen it in places like New York City and, you know, the big metropolitan areas. But the good thing is at More Smiles, it's free. As being a patient, you get the in-office whitening for no cost.
Really?
Yeah.
Sign me up. That's really interesting. That's really great. So you do that for all your patients?
We do it for all the patients. You know, it's called Whitening for Life, and basically what happens is as you become a patient of More Smiles, we custom make the trays for you. We give the whitening gel, and then every you know, 6 months when you come back to the dentist, we give you a couple tubes, and you can whiten your teeth forever.
All right, that sounds good. Dr. Moriarty, thanks so much for coming in.
Thank you.
All right, Jeff.
And I've been
You've been paying
sandpapering
for
my
it.
teeth